Welcome back. Right now, the FDA approving a new, stronger flu vaccine. It is the first one to include a special type of immune-boosting compound designed to give seniors or keep them from getting sick. So let's bring in Dr. Frank Esper. He's a pediatric infectious disease specialist at University Hospital's Rainbow Babies and Children's Hospital. Thank you for joining us. Happy Thanksgiving.
Happy Thanksgiving, Heather. How are you? I'm
doing great. And so does this new flu vaccine mean that less people will come down with the flu this year? What exactly is this immune-boosting compound?
Yeah, well, one thing to make sure is that while we want less people to get sick, one of the biggest reasons that we give everyone the flu vaccine is to prevent people from getting hospitalized and dying from influenza. And that's the biggest point that we want to make when we give everyone the flu vaccine. We're trying to prevent serious disease. If everyone just has a little mild cold, cough, and fever and are on the couch for a couple days, that's fine. What we're seeing, though, now is that there's many different types of influenza vaccines. In fact, what we're seeing is that a lot of these vaccines are now being tailored to specific populations. It's no longer the one-shot-fits-all kind of phenomenon that we have with our tetanus or our pertussis. This is these new vaccines are going after the highest risk populations. At least the vast majority of all the deaths are usually in 65 years and older because their immune systems just don't respond well to vaccines. And so now we're doing all these certain types of tips and strategies in order to boost their immune response when we give them a vaccine. And this new one from the FDA is sorely needed, and that we expect that that's going to help a lot of the people who are older than 65.
In that population, yeah. Well, last year, if I recall correctly, people that got their flu shot early on in the season, it then didn't end up working because the flu itself, it morphed or changed. Is that what happened? Yeah. Okay, is there a danger of that happening again? And so we would go out and get this shot and it's useless?
No, this shot is not useless, and honestly, the last year's shot was not completely useless. It just didn't work as well as we want. We look at things called the vaccine effectiveness, where you say, well, how effective is this vaccine in preventing people from going to the hospital or going to their primary care provider with flu-like symptoms? And it was only 18%. Right? It's not zero, but it's not the best. We like a good vaccine effectiveness to be closer to 50 to 60%. We've already tested every flu strain that we've seen from October all the way through to where we are right now. Hundreds and hundreds of flu strains. We've tested them all against this vaccine. This vaccine is a bullseye. It has hit each and every one that we have seen thus far.
And you consider it successful if people don't have to be hospitalized from it. Is that what I heard you say?
That's the main goal. Yeah, that's the main goal. The main goal
I don't want to get sick. I don't want to get the flu and be coughing and spreading it to my coworkers. But you can't guarantee that that won't happen, right?
I mean, the answer is no, because a lot of times the people who come in with cough and flu-like symptoms, sometimes they don't even have the flu. It's another virus out there. There's hundreds and hundreds of different viruses, half of which we don't even know the names of because we haven't discovered them yet. But the flu is the biggest one, the baddest one. That one we do see that causes a lot of people to have to come into the hospital. People who are old, the very young, under 2 years of age, people who are sick with cancer or receiving chemotherapy, pregnant women. These are people who are at really high risk of coming into the hospital, getting pneumonias, and sometimes dying. And that is the main goal of why we try to get everybody the flu vaccine. You're not only protecting yourself, you're protecting everyone else around you.
Absolutely. Dr. Frank Esper, thank you so much for joining us. We appreciate it. Thanks.
Very good to be here.
So when our floor director, Dave, was coughing up a lung earlier today and just infecting all of us, no wonder Dave wears black every single day. That's an omen. Sorry, Dave.